Hello, everyone. I hope you are having a great day. If this is your first time visiting this channel or reading this article, I am very happy to welcome you. My name is Hafiz, and I am currently training in cardiology in London. On my channel and in my articles, I aim to provide clear, accurate, and comprehensive knowledge about heart health so that you and your family can take better care of your heart. Today, we will explore the 5 most common signs and symptoms that indicate a weakening heart. Heart failure occurs when the heart cannot pump blood efficiently to meet the body's needs. This does not mean the heart stops working completely, but early detection and proper treatment allow patients to live healthy, active lives and prevent dangerous complications. Why early recognition of heart failure symptoms is important. Heart failure usually develops gradually, often silently over many years before noticeable symptoms appear. Recognizing the early signs can allow timely treatment and improve survival rates, prevent frequent hospital admissions, reduce the risk of serious complications such as pulmonary edema, arrhythmias, or stroke. Many people mistakenly believe heart failure only affects the elderly, but it can occur at any age, especially in those with risk factors such as high blood pressure. Forces the heart to work harder, causing heart muscle thickening. Diabetes damages blood vessels, increasing the risk of heart failure. High cholesterol contributes to coronary artery disease. Obesity increases workload on the heart. Smoking and chronic stress cause vascular inflammation and arrhythmias. History of heart disease, such as heart attacks, myocarditis, or valve disease. Understanding these warning signs helps everyone monitor and care for their heart health daily. ICAID. The top 5 warning signs of heart failure. 1. Shortness of breath. The most common symptom. Shortness of breath, dyspnea, is usually the first and most noticeable symptom. Patients may experience breathlessness when walking, climbing stairs, or performing light activities. Difficulty breathing when lying down, often needing extra pillows or sitting upright to sleep. Waking up at night due to breathlessness, paroxysmal nocturnal dyspnea. Physiological cause. When the heart cannot pump blood efficiently, blood backs up into the lungs, causing pulmonary congestion. Fluid in the lungs interferes with oxygen exchange, making the body feel short of breath. Real-life example. A 5-year-old patient said, "I feel out of breath after just a few steps in my house. I used to be fine. I also have to sleep with 3 pillows." Prevention tips. Engage in gentle daily exercise, walking, yoga, breathing exercises. Maintain a stable weight. Control blood pressure and monitor blood sugar levels. 2. Swelling. The body retaining fluid. Edema, swelling, occurs when fluid accumulates in tissues. Common areas include ankles and feet, lower legs, sometimes extending to the knees, abdomen, ascites in advanced cases. How to recognize it? Press lightly on the skin. If an indentation remains for a while, it indicates fluid retention. Physiological cause. Heart weakness causes blood to back up, and the kidneys retain salt and water, leading to fluid accumulation in tissues. Swelling is usually worse at the end of the day and improves after rest. Real-life example. A 8-year-old female patient said, "I noticed my ankles swell during the workday, but it goes down by morning. At first, I thought it was from standing too long, but the doctor told me it was a sign of heart failure." Prevention tips. Elevate legs when resting. Avoid prolonged standing. Limit salt intake in the diet. 3. Unexplained weight gain. The silent alarm. Rapid weight gain over a few days may indicate fluid retention, not fat gain. Monitoring weight. Weigh yourself in the morning before eating. Keep a daily record. Notify your doctor if weight increases is greater than 1 kilogram in 24 hours or is greater than 2 kilograms over several days. Dry weight concept refers to a patient's weight without fluid retention, helping doctors adjust diuretic medication accurately. Real-life example. A 60-year-old male patient noticed a 2.5 kilograms weight increase in 3 days, along with shortness of breath and leg swelling. After adjusting diuretics, his symptoms improved quickly. 4. Palpitations, rapid heartbeat, or arrhythmias. When the heart is weak, the body compensates by increasing heart rate to ensure adequate blood flow. Patients may feel rapid, strong, or skipped heartbeats, a fluttering sensation in the chest, risk of arrhythmia. Atrial fibrillation, A, is common in heart failure, causing irregular heart rhythms, increasing the risk of blood clots and stroke. Real-life example. A 2-year-old patient experienced palpitations and fatigue, diagnosed with AF and heart failure. After treatment, his heart rhythm stabilized and his quality of life improved significantly. Prevention tips. Control blood pressure and blood sugar. Avoid stress, excessive caffeine, and alcohol. Monitor heart rate at home if devices are available. 5. Persistent fatigue. Body lacking energy. Fatigue is often overlooked or mistaken for stress or sleep deprivation. When the heart cannot pump enough blood, organs receive less oxygen and nutrients, leading to fatigue even with light activity, reduced stamina, a heavy, sluggish feeling throughout the body, difficulty concentrating or feeling sleepy. Real-life example. A 5-year-old female patient said, "I feel tired all day, even without doing anything strenuous. I often need more rest and have trouble focusing on reading." Prevention tips. Practice deep breathing, light yoga, or short walks. Eat a balanced diet rich in fruits and vegetables. Ensure adequate sleep and rest. IFRI. Lesser known, but important symptoms. Besides the 5 main symptoms, heart failure may also present with 1. Loss of appetite or bloating. Fluid in the abdomen puts pressure on the stomach. 2. Persistent cough or wheezing. Fluid accumulation in the lungs. 3. Frequent nighttime urination. Fluid returns to circulation when lying down. 4. Dizziness or lightheadedness. Reduced blood flow to the brain, especially when standing up quickly. 5. When to see a doctor? Immediately. Seek urgent medical attention if you experience severe shortness of breath with chest pain. Rapid swelling or weight gain is greater than 2 kilograms in 3 days. Continuous palpitations or fainting. Coughing up pink, frothy fluid. Acute pulmonary edema. Daily heart care and prevention tips. 1. Diet. Limit salt, sugar, and saturated fats. Eat plenty of vegetables, fruits, and whole grains. Drink enough water, but follow doctor's instructions if fluid retention is a concern. 2. Exercise. Gentle walking, yoga, swimming. Avoid strenuous exercise if the heart is unstable. 3. Manage underlying conditions. Monitor blood pressure, blood sugar, and cholesterol. Regular heart health checkups. 4. Regular monitoring. Daily weight checks. Monitor heart rate and blood pressure. Track symptoms like breathlessness, swelling, and palpitations. 5. Stress reduction. Practice meditation, deep breathing, and get adequate sleep. Frequently asked questions. Q. Can heart failure be fully cured? A. Currently, it cannot be completely cured, but proper treatment helps manage symptoms, improve quality of life, and increase life expectancy. Can people with heart failure exercise? A. Yes, but only gently and under doctor supervision. Q. What symptoms appear first? A. Usually shortness of breath during activity and persistent fatigue. 7. Conclusion. The heart is a resilient organ that works continuously throughout life, but it also requires proper care and attention. Recognizing early warning signs of heart failure helps prevent complications, improve health, and extend life. Listen to your body daily, monitor your symptoms, and seek medical care when needed. Early detection, timely treatment, healthy, long life.